We're going to go ahead and go through the housekeeping items now. So again, thank you all for attending the meeting. The meeting is being recorded. So please contact Alana or send a chat message if you're having technical issues. Her information should be in the email that was sent to you. She'll also enter it into the chat. So you can mute or unmute yourself using the small button at the bottom of your screen that looks like a microphone. Please remain on mute when you're not speaking to reduce the background noise. You may mute if staff may mute you if there's a lot of background noise, but you can always unmute yourself. If you're on the phone and you want to unmute, I believe it's *6. You can use the chat function to send notes to all attendees. You cannot send a chat message to specific attendees with this technology. Feel free to add your comments and feedbacks to the chat window during the discussion if you'd like to. And please announce yourself when speaking. Since there are a number of people in this meeting, we'd like to sequence speakers when possible. So please raise your hand. There's a button at the bottom of your screen that says raise hand. So please use that button. Staff may also call on you to ensure we have a wide range of perspectives. So I'm now going to call out the names of the people that I see in the log. And if I'm missing anyone, please let me know. And why don't you just tell us who you are, what organization you work for, and then what your role is in PFACs. So I'm going to start with, I see someone named Gina W. Would you like to introduce yourself?
Hi, my name is Regina. I'm the practice manager for primary medicine. We have 5 locations throughout Maryland.
And what is your, thank you for joining us. What is your role in PFACs?
I don't really have a role. I'm just trying to observe.
To learn more about them? Are you guys part of the MDPCP?
We are.
Yeah, so are you, so you know that part of track 2 is conducting the PFAC. So it's great. I'm glad you could join us today. So the next person I see is Victoria Kerr. Would you like to introduce yourself? Okay, so there's someone identified as B. Hawana, BHAWNA. Would you like to introduce yourself and tell us about your organization and your role? We have a Dr. Faber. Would you like to introduce yourself?
Yeah, hi, I'm a pediatrician with Easton Pediatrics. We're part of Child 10 Community Health System, and I do most of the child psychiatry for the system. We have 5 practices covering a large area, 3 counties on the Eastern Shore. I don't know that we're part of PFAC before. We're just interested in what you wrote in the email.
Great. Are you one of the practices that's going to be in the MDPCP?
I'm not even familiar with those terms, so I'm not sure.
Okay, what those terms are. Okay, that's the Maryland Primary Care Program that they opened up to the FQHCs for next year. So it's the
yeah. Sure.
Okay, that's okay. Thank you for joining us today, Dr. Farber. How do you say? Is it Faber?
It's Faber.
Faber. Okay, great. Thank you. Melody Warner, would you like to introduce yourself?
Yes, I'm a registered nurse with Caregivers of the Potomac. However, I run the PFAC for Dr. Catterpool at Turn City Healthcare.
Okay, great. Thank you. Margaret Smith, would you like to introduce yourself?
Hi, everyone. Can you hear me?
Yes.
Hi, so I am from St. Agnes Hospital. I have been working on the care management side of things, working a lot with MDPCP. Starting in January, I'll be clinical program coordinator on our quality team and working with our CTO practices. I haven't attended a PFAC, but I'm excited to learn more about it, and I'll be attending my first one next week.
Great. Thank you. So we have someone on the phone with a phone number ending in 00. Would you like to introduce yourself? And then we have a Dr. Rahman, R-A-H-M-A-N. Would you like to introduce yourself? Okay, so I think I'm going to go ahead and get started. Is there anyone who's on the phone who would, my camera and microphone are not working? Alana, can you try to reach out to Dr. Rahman? Alana, is Alana's information is in the chat function. If you'd like to reach out to her, maybe she can fix it. Are you using Google Chrome, or are you using one of the other, like Explorer? Because sometimes if you use Explorer, it's hard to the microphone doesn't always work, but Alana can certainly help you. You're using Chrome and it's still not working. Okay, well, you're welcome to reach out to her, or you can put your comments into the chat box and we can communicate with you that way if that works for you. Is there anyone else on the phone or online who'd like to introduce themselves? Okay. So we will go ahead and move forward. We do have a couple people who just joined us, so they can feel free to kind of jump into the conversation. So what we're doing here today is we are going to talk about how patient and family advisory councils evolved during the COVID-19 public health emergency. And we want to let you hear from other practices about what they have done to account for this. And hopefully we're going to be able to develop an addendum to our PFAC guide for ambulatory practices. And it will be focused on the impacts of the public health emergency that's based on these deliberations. So what we're going to do is we're going to bring up some grids that have discussion items. And those items have been simplified to help focus the discussion and narrow to specific topics. So the way this works is it's kind of like a typical SWOT analysis. So you can move down a little bit and then to the first grid. So we talk about the successes, the challenges, the opportunities, the key themes, and the recommendations. So you'll see there are some items in here that our other focus group authored up. So for discussion item 1, engaging patient and family advisors during the COVID-19 restrictions. So some of the successes the prior group offered were the PFAs can provide useful feedback on changes in care delivery during the public health emergency, and preparing the PFAs to use technology for virtual participation ensured continued participation when in-person attendance was not possible or preferred. Some of the challenges are the practices did report reduced turnout, and some of the opportunities were allowing patients to ask questions about changes to care delivery during COVID, and being able to maintain their PFE participation and recognizing their contributions. So I'd like to reach out to the group now and see if someone would like to talk about their involvement in this area, and if they want to contribute a success, a challenge, or an opportunity. Any of those areas is fine. So would anyone like to start us off? Regina, do you want to give us some information about?
Yeah.
Oh, okay, Melody, go ahead.
One of the successes we had when I first did the meeting before the whole virus happened was the patients. It's a general practice, and so a lot of the patients are elderly. They're not so technology hip. And one of the things they suggested was providing a printout of the instructions, as opposed to, most offices, they say you can go into your portal. And so the office implemented that change, and then we just had our meeting, and they were very happy with that. All the patients said that was a success. So it was something simple that we wouldn't have thought about.
So how did they get the printout? Did you send it email?
The front office printed it out for them before they left.
Oh, okay, before they left. Okay. Thank you for that. How about any challenges or opportunities that you guys would note? Let's see. So Margaret, would you like to contribute anything to the challenges or opportunities or successes?
I don't really have anything to contribute, only because I'll be attending my first PFAC tomorrow, so I'm not exactly sure about any challenges that we've encountered thus far.
Okay. Regina, would you like to contribute something?
No, I don't have anything.
Okay. Okay, so is there anyone online who wants to add anything to these successes, challenges, or opportunities? I'll wait just a second and then we'll move on to the next grid. Okay, so I'm not seeing any hands up or, okay, so let's go ahead and go to the next grid, Anana. So the next grid is PFAC meeting facilitation during COVID-19 and how that's changed. So some of the prior feedback that we got from practices were successes, having outdoor meetings or indoor socially distanced meetings to continue to receive the feedback from PFAs. Selecting discussion topics based on changes in practice and care delivery. And the common topics included reducing the emergency department utilization, care management, changes in care team structure, patient preferences for care delivery and communication, and changes or updates related to COVID-19. So for challenges, the space availability for in-person participation for PFAs and staff was a challenge for some practices because they just didn't have the room. And so some of the opportunities presented were assemble the clinical team to plan the PFAC agenda and identify patient and practice challenges prior to the meeting. So would anyone like to weigh in on how the PFAC meeting facilitation changed for their practice during COVID-19? So Melody, I'm gonna kind of pick on you again here. Did you guys have any changes to the meeting facilitation?
Yeah, we had to spread way more out. We had to check everybody at the door to make sure it was over their nose. Their mask was actually over their noses. I guess the main stuff you would think of, nothing too out of the ordinary. We made sure our
Were you
chairs.
doing like temperature checks?
Sorry?
Were you doing temperature checks or a questionnaire or anything when they came?
We did temperature checks.
You did temperature check, yeah. Just checking the chat to see if anyone else wanted to. Does anyone else want to weigh in on how their meeting facilitation changed? So did your topics change more to those related to COVID-19, or did they tend to stay more broad about your practice in general? So Melody, that was directed at you about the topics.
Okay, sorry. Yeah, we talked about COVID-19. It was more focused on if the patients felt safe still coming in, if they weren't able to do a video visit, and then helping them with the technology if they did have a video visit. So it was a lot of conversations about like making sure the technology was fit for them, and then making sure they felt safe coming into the office.
So did you guys make any changes to your protocol based on the input from the PFAC?
No, they were actually all very happy.
Great, great, that's good news. Okay, so I'm just going to give it another second to see if anyone else. And I see we have a couple new people. Jeanette Meadows from Carol Ritter, GYN. Would you like to just introduce yourself quickly and tell about your role? Okay, I'll give people a minute. Okay, so let's go ahead and move on to the next grid, Anena. So this is about the use of technology for PFAC meetings, and some of the other practices we're talking about. Oh, hi, Jeanette. How are you? Welcome to the meeting. We just wanted to see if you wanted to introduce yourself or weigh in. I think you're still on mute. Oh, okay. So let's go ahead and go through the successes, challenges, opportunities, and key themes. So some of the successes about the use of technology was the virtual meeting did allow for remote participation. The technology challenges are prevented, and the FAs are comfortable when they were provided with technical support and opportunities to test the technology prior to the PFAC meeting. Challenges, some PFAs lack the technology to accommodate remote participation, and the comfort level varies among the patient populations. I guess I'll go back to you, Melody, and ask, did you guys find this? Did the use of technology with any particular patient seem to impact their participation? I know you said you printed the directions and that helped, but did you notice any changes?
It's hard for me to say because I'm an outsider going in. You know, I don't work with that practice. I just meet with them every 6 months just to kind of see what they say. So it's hard for me to say if any technology changed.
Okay. Well, did they have them? They had them in person prior to COVID, and now they have them remote?
Yes, unless it's an issue that requires to be seen in the office.
Okay. So some of the opportunities that the other group identified were offering a combination of virtual, telephone, and in-person meetings. So what they would do was let the people who wanted to come in and were able to come in safely and social distance to do that, some people to phone in, and then obviously some people to join via the web. To identify patients who have the capacity to participate in remote meetings, to identify their PFA's preference for receiving communication. So this was an important one that we got from another practice. So they used to send out everybody's communication the same way, but one of the practices was able to set up a system. So some people get texts, some people get emails, and some people get phone calls based on what their preferred way to communicate. They have a particularly large PFAC. They have 29 people on it. So I guess if you have a smaller one that's only 1 or 2, it's probably not as big a deal. Leveraging technology-based methods for gathering information when meeting is not possible. So this is another thing some practices said. If they weren't able to do like a Zoom meeting, an in-person meeting, they would send surveys, questionnaires, and emails to people to try to gather information that way. So I'll pause for just a moment and let people weigh in and see if there's anyone who would like to weigh in on this from their practice's perspective. Okay. Juana, you have your hand up. Would you like to make a comment? I hope I'm saying your name right. I apologize if I'm not. So if you're speaking, you would be on mute. We can't hear you. You can always add it to the chat if you aren't able to, for you to email presentation. So someone just put in the chat, they were asking, oh, there you are. You're off mute now.
Yeah,
Go
no,
ahead.
I'm sorry. Yeah. This is Bhavna Pahethi, internal medicine. So my concern was that, I'm getting started on PFAC, and one of the reasons for my meeting is to see, what other practices are doing for like the challenging patients, because they're the ones who need it most, but have the least support in terms of family, technology, have a flip phone. That's the only thing that they're with. Is there, do we,
Right.
How do we go about for those challenging? These are the ones who've been in the hospital a couple of times, and we really need to get a handle and things around that, but have had difficulty. Are there some resources additionally that, we can say, okay, what has worked for other practices? Please help us out with this. So is there someone who we can turn to for more specific assistance?
So we do have a larger PFAC guide that's available, and we'll make sure that everyone on the call gets access to it. So we've heard a similar response from other practices that some people only have flip phones. They don't have camera phones, smartphones, and so they only have audio available to them. So there's also a really good resource that we can point you to that has it's online. It's that might be able to help you out a little bit with that too, and how to communicate with those patients. So we can send a couple of resources to you. I don't know if anyone on the phone might be able to give her some advice on how to reach these harder to reach populations that don't have a lot of family support. So we will send you those resources, and then the other thing we'll do is reach out to some of the members of our other focus group to see if they can assist with that question specifically for you. And if you could send that question to us in writing and I could send that around, that would be helpful.
Okay, will do.
Yeah, and then I'll send that around to other people who participated. So let's see, I went through the opportunities here. So let's go ahead and move on to the next grid. Oh, I see Jeanette added a comment here. We asked patients if they have someone like a grandchild or a caregiver that can assist. So Jeanette, we did hear that from some practices that they often turn to, they ask, if there's a neighbor or a younger person that's involved in their life that might be able to help them with the technology if they need to do some type of a video visit or some type, so they might have the camera phone or the computer that they can bring over to help with. So that's a good suggestion. We'll make sure that we get that around. So discussion item 4, ensuring equitable representation of the patient population as compared to in-person meetings prior to COVID-19. So this gets to a little bit to the comment that was just made, which is some people feel that it's harder to reach some of those populations that maybe only have the flip phone, maybe they don't have good internet access, and they are not able to come in person. So how do you continue to ensure that you have equitable representation of your patient population? So some of the practices said that continued and consistent outreach maintains the interest during a time when they may be unsure of their role due to the restrictions. The challenges are the preference for in-person meetings by some of the patient family advisory councils or advisors. So some of them said that some of their more senior members or the most senior members actually prefer to be in person. They didn't really like to do the video or the online, and some of them weren't able to. Overall, lower utilization of healthcare services limits the ability to recruit new PFAs. So we've heard this as well, fewer people coming in, so fewer opportunities. And then the opportunity is to seek seek participation in alternatives for underrepresented groups. So is there anyone online who'd like to weigh in on any of these successes, challenges, or opportunities that have been identified by other practices? So give you guys a couple minutes. So you can either put it in the chat or you can raise your hand, whatever works better for you. Okay, so I'm not seeing any additional comments to this one. Melody Warner. I've only had 2 meetings, 1 patient last since COVID started. Okay, Melody, so are you saying it's been kind of the same? It really hasn't changed too much for you?
It really hasn't changed too much, but it's hard to gauge because we've had 1 meeting before COVID started and now our 2nd meeting after COVID. And it's like I said, we had 1 patient less come in, so it's hard to tell. But it's different if you're a small practice versus you're, a hospital system.
And do you think that person didn't come in because of technology issues? Like they just didn't have the appropriate technology to participate?
No, her husband came in. She broke her hip.
Okay.
It wasn't there.
And can I ask how big the PFAC is that you run?
It's only 5 people.
Yeah, it's still a reasonable size. Okay, thank you. Thank you for that input. Would anyone else like to weigh in either online or in the chat function for us on this grid? And how the equitable representation, if that's changed or you think it's stayed relatively the same?
I have a question in terms of, I'm learning from other practices. So is there a minimum PFAC size that needs to be in order to be, obviously you want the stakeholders, so you want someone from the practice and the provider and maybe a family member and the patient. Is there a certain number that is what is an average being done for other, other PFAC meetings? Is there some that have found that definitely having someone in makes a difference? Is there a particular key person that needs to be there? Is there something like that other practices have shown advantages or benefits with?
So I'll offer this up to the practices and then I'll kind of answer that to the best of my knowledge for you. Does anyone want to weigh in on her question? So there is a section on this in the guide and about how many participants you should have. It does vary a lot, obviously. And as far as the staff, there's kind of different approaches, and some people think like the physician or a senior person should be there, but some think that people are more willing to give input if the most senior person or the physicians are not there, and it's more just the care staff and than the medical office staff. So, I in general, this is a pretty general term, but there's about at least one kind of patient per provider, but there is more information in that guide that you'll see. Again, the other, it varies widely too. Some of the hospital systems, some of them have very large PFACs, but some of them have smaller PFACs. The person from St. Agnes, do you know what size your PFAC is? I think that's Margaret. Maybe she's not on anymore. Yeah, she might not be on anymore. So, it varies widely, but we'll send you some information on that as well. So again, if you want to kind of put your questions into writing, we're happy to send you written responses to assist you with those. So let's go on to the last grid we have. So the last grid we have is involving PFACs and PFAs in planning practices, COVID-19 challenges. So this is like really asking patients, how should we be doing this? And forgive me, I know one of you guys waited on this, is probably Melody, that your practice was doing that. So I guess, have you had success or challenge, and what's the opportunity here? So would anyone on the phone or online, like you can either do it through the chat or raising your hand, like to weigh in on this? I know in the prior call, we don't have it recorded on this grid, but one of the practices was using their PFAC to help guide their COVID-19 policies. So let's see, I don't see any hands. Okay, so it sounds like maybe you guys haven't really gotten into this too much with your practices. So what we will do, I'll go ahead and kind of wrap this up unless people have additional things they'd like to add. So what we will be providing to you for providing us with your time today, we'll send these grids when we're done with our last focus group so that you can see the feedback that other practices gave us. We'll send around a copy of that guide, which is has a lot of useful information about PFACs, as well as additional resources where you can find answers about your PFACs. And if you want to send us questions in writing, specific questions, we will point you to resources that can help you to answer your questions as well. So does anyone have any final things they'd like to add before we end our call today? Okay, well, I want to thank everyone very much for joining, and we appreciate your participation and helping your fellow practices to learn about PFACs. Thank you. Bye.